The discussion covered assessing family planning services at different places, focusing on how drug shops help.
But also we can use the redistribution between pharmacies through linking them to partners, drug shops. Redistribution between the drug shops through linkages to partners and alternate distribution systems.
The meeting shed light on the landscape of family planning services in Uganda. Dr. Mugahi highlighted the importance of family planning for safe motherhood, citing its role in lowering maternal mortality.
So offering a family planning method within the 24 hours. And of course there are challenges. Some of them put us under pressure. Immediately they deliver, they go even before the 24 hours elapse. But we need to evaluate them at 6 hours. So it's also a call to request mothers to stay in the facility at least for 24 hours. And we are now advocating that mothers should be counseled. It's not forced. Family planning is not forced. It is voluntary, and you are given a choice of methods where you are able to choose which method will work for you.
Nearly half of pregnancies are unintended, with a staggering 62% occurring among teenagers.
We don't want a mother to be pregnant twice in the same year. And it is possible because women are very fertile. So it is possible. We want to provide them with methods that do not enable them to get pregnant at shorter intervals.
Dr. Frederick Makumbi stressed the need for postpartum planning and empowering women to reduce unplanned pregnancies.
There's been a significant training and improvement in the number of facilities with health workers who can insert and remove implants. About 90% of the facilities were able to do that. And about 60% of the facility reported having somebody trained to insert or remove IUDs because those need specialized training. That's about 60%. So, which means we need to make sure, working with the Ministry of Health as evidence generators, present this information, work with partners and identify those gaps, and then I'm sure the Ministry of Health and partners are going to work around improving the training.
The research aimed to assess facility readiness and evaluate policies for accessing family planning services.
That young people out there, some of them are sexually active. They need these services, and some of them are actually already getting them. As you heard in our discussion, when you look at the data, you know some of them are accessing them. There is still not yet a clear policy direction in terms of the very young ones and the package and approaches we should use to serve them, but they are sexually active, and when they are, we need to provide that service.
Sudat Kaye, UBC News.